As you plan your big 4th of July gatherings, the CDC is issuing a warning about a new aggressive COVID-19 variant that is currently spreading. The agency says it could lead to a summer wave of the virus. And tonight, Jeremiah Jacobson has everything you need to know about the new COVID variant, including the defining symptom in those infected.
It's related to the Omicron variant. NB181, nicknamed Nimbus, is spreading in the U.S., now causing more than 40% of COVID-19 cases, according to the latest CDC data.
It is a little bit more infectious and contagious than kind of the last couple of versions that we have seen before. So we're seeing a pretty rapid rise in the number of cases related to Nimbus.
Dr. Carrie Horn with National Jewish Health says as people gather to celebrate the July 4th holiday, there's an increased chance for the virus to spread even more. She says in addition to the symptoms with previous variants like fever, runny nose and congestion, some shortness of breath, cough and body aches, the defining symptom for this variant is what she calls a razor blade sore throat.
It is really intense and it can last for a couple of days. And it's even as bad as like when you're just swallowing your saliva, just normal swallowing. It doesn't have to be with food or liquids or anything, just super intense pain.
To slow the spread of this variant, Horn says to stay home if you're having symptoms, and if you do go out, wear a mask and continue washing hands. If you're at high risk of getting severely sick, she recommends getting the updated COVID-19 vaccine.
The real benefit of the vaccine is keeping people out of the hospital, preventing severe illness and death. So anybody who's high risk, I strongly recommend getting the vaccine.
If you test positive for COVID and are immunocompromised or have other high-risk factors, doctors say see a healthcare provider who can prescribe antivirals. Also, parents be aware that the sore throat and symptom in children could also be strep throat, not COVID, and that is treated differently with antibiotics.